Good morning, good morning, good morning. Welcome, welcome. My name is Dr. Debbie Green. Welcome, welcome. I'm so glad you joined me this morning. I'm so glad that you are here. And I hope that you have a restful mind this morning. I hope things are working in your favor. I hope that you slept well last night. And it's just important, it's important to just take care of yourself. And if you haven't done that lately, please do so. Please take care of you. Because guess what? That's all you got is you. It's only one you, right? And you are very special and you need to be taken care of. So I just want to put that out there for you. Today's topic is going to be pretty interesting. It's not something you haven't heard before, but I want to dove down into just the statistics of this. And our topic of the day is alcohol fetal syndrome and the aftermath of after it's over. What happens during that time? What happens after? How does it affect the child? How does the life of the child overall, even as an adult, what happens? I think when people hear that, it goes in one ear and comes out the other if you have never experienced it. If you don't know anyone that has ever been affected by it, then it's just not something you pay attention to. But I want to give you some much needed knowledge. There is a lot of individuals that have been greatly affected by this particular disorder. And I definitely want to give you as much information as I can. So if someone is listening, if someone is, in the process of carrying a child and maybe drinking or any of those things, someone who is drinking, carrying a child, um, please pass along the knowledge because it's very much needed. It's much, much needed. So, what I'm going to be doing, I'm going to actually be coming from, you know, the statistics of this particular disorder, which is from the American Medicine Prevention as well as the CDC. So, all the knowledge that I'm giving you, far as statistical knowledge, is definitely from that area. And some of the knowledge I'm also going to be giving you is how the child's mind is affected, but most of all, how the mother is affected as well in this particular situation. Because we know addictions are very, very real, and people are definitely going through a lot right now. They're going through so much to the point where they are not thinking. They're really spontaneous. They're spontaneous, and they're just reactive. So they're not saying, "Oh, if I do this, this is going to happen," or "If I do that, that's going to happen." No, they're not thinking that way. They're just feeling through their moment, and unfortunately, it's causing a really rough. I don't even have words to describe what's happening in the world right now, y'all. It's just everyone is I call it hypersensitive to everything, it seems. So if you got a calm mind, a mind of logic, you better hold on to it. Hold on to it. And especially giving love. If you're giving love, let me not say giving love, because some people want to always receive it, but they don't want to give. Learn how to give and receive in balance. And that's going to really, really change your life tremendously. So, again, these are just Dr. Deb's little note sheets putting out there for whoever wants to listen, honey, whoever wants to hear. All right, so let's get into the statistics of this. When I was studying this, you guys, I was like, wow, it's not like, when I actually create these topics, I some of them I just know from experience, and some of them I literally have to go and do some research on because I don't want to give you knowledge that has not been looked at or actually been quantitative or qualitative, which is tested, researched, so that you can have the most accurate information. And I want that to be known for sure. So I'm just speaking in the US right now, okay? So all of the information I'm giving you is based upon US, United States data, again, from the CDC as well as the American Prevention Medicine areas. So let's start here. Let's start here dealing with the pregnant women, okay, and their alcohol use. 1 in 7 drink when pregnant. 1 in 7. Now that may not be a lot to you, but we have billions of people on earth, okay? So 1 in 7, that is 14% of 100, okay, which is still too high. I don't think it should be zero, but it's 14%. 1 in 7. 1 in 7 pregnant people reported current drinking, when they were carrying their child. Okay. And the thing about it was like you had some of them that drank casually, socially, and then you got some of them that binge drink. Binge drinkers was 1 in 20. 1 in 20. So that's 5 out of 100. Okay. So if you say out of 100 people, out of 100 pregnant women, we have 5 out of 100 that was binge drinking carrying their child. And you wondered, you're like, well, why would they do that? Why would they drink when they know that they're carrying a child? Well, you have this thing called addictions. Okay. Addictions have no specific prevalent logic. It's like, I just need it, I want it, and that's it. Now, I'm not saying every addicted person does not take in consideration of their children when they are pregnant, but when you are addicted to drugs or even alcohol, it's very difficult to not drink when you're addicted to something. So you find yourself doing things that really and truly you really shouldn't do, you know, which is affecting, your own child's life. So that itself changes everything. It changes everything in the mother. It changes everything in the child, as far as mental, emotional, physical, all your whole being is changed. The whole being is changed. So it's not like, oh, well, it's just going to get better over time. No, it does not. The substance alcohol is a depressive substance, but not only is it is depressive, it also alternates the inside structure of a body. So think about it. This woman's been drinking for a period of time. Now she's drinking, carrying her child. And that alcohol is going through that baby's bloodstream. Do you not think it's going to affect that child overall? Absolutely. Absolutely. It's going to, as that child grows, it's going to look different. It's going to behave different. It is not the same. So statistics says between 18 and 44, that's the ages that people mostly drink, between 18 and 44 in the United States. It increased a little more from 2018 up to 2020. Well, we know what happened in 2020. We were totally shut down. So if there were any addictive habits that a person would have, then it would increase, and that would be normal for it to increase. So in 2023, the CDC researchers found that 80% of people who were pregnant were asked about alcohol use. However, only 16 of those who self-reported drinking within the past 30 days were advised to quit or reduce their use. These findings highlight missed opportunities to integrate alcohol in practices, utilizing strategies to address recognized barriers. improving reimbursement alcohol, and help reduce alcohol use in pregnancy. So, what am I saying to you? If they actually went in for a well check with the baby, because a lot of times they don't go. People with addicted symptoms don't always go to the doctor. They miss appointments. They're not all the way obligated. So the baby suffers. So when they do come to the doctor's office or whatever, wherever they find themselves in, if it's not a doctor's office, it could be a health clinic or wherever. If if they are drinking, if they don't do a blood count, they don't know. So a lot of times those individuals don't tell them unless they come there, intoxicated or something, or some kind of sign will know that this person's been drinking. But otherwise, they don't know until they do a toxicology report. So this is what this saying is saying, that some of it's known and some of it's not known. So if it is known, the doctor will tell them you need to stop drinking while being pregnant and carrying the child. Okay, sometimes that happens, sometimes it doesn't. Because again, addictions are real. And I'm not justifying addictions, I'm just letting you know that it's very difficult for a person to stop what they're doing, especially when they're feeding something inside of themselves. So in 2020, CDC reports found that 81% of U.S. adults in 13 states and Washington, D.C. reported being asked by their healthcare provider about alcohol use. Only about 38% reported being asked about binge drinking during routine checkups in the last 2 years. Among adults who reported being asked about their alcohol use at the checkup in the past 2 years and reported current binge drinking, 80%, that's 4 of 5 persons, were not counseled to reduce their drinking. Routine alcohol screenings and brief counseling has been shown to be effective at reducing binge drinking and is recommended for all adults. Okay, let me go ahead and paraphrase this. When the doctors did find out, they didn't say, well, maybe you need to go to a rehab. Let's refer you to a therapist. Let's refer you to, a substance abuse residential program. That was not done. All they told them was, you should stop drinking, but not refer them out to get help and assistance. And this is what I have problems with, you guys, because I am a healthcare worker and I'm on the front line. I get to see up close and personal when things fall apart in people's lives. And one thing I deal with every day is substance abuse and also, mental illness, because they are very close. Okay. They're very, what they call vertical, not horizontal, vertical. So when that happens, I notice in statistics, if I had to give a statistic, I would say 3 out of 7 have addictions, they have mental illness. That's what I would say. And that's only like maybe a 23% percentile. They're either getting over an addiction or had an addiction in the past or presently dealing with addiction. But those numbers work. They work. Now, and you ask them, if they're women, if they had children, were you using at all when you were carrying your child? Some will tell you the truth and some won't because they're too embarrassed. They're too embarrassed to let anyone know that they were not. So, what am I saying? When they go to the healthcare provider, it's a good chance they're not telling. I think the healthcare providers need to do toxicology every time they come there. But I know somebody's listening. When you go to your checkups, your OB, she just looks at the baby. She doesn't, well, she listens to the heartbeat, heartbeat's intact, and that's pretty much all. Now, she may do a toxicology, but it may be early on. And if it isn't, saying something to her, like something's wrong or whatever, they don't look. They just do minimum. I think they need to do maximum to save a child's life, because there's a good chance that, again, the baby is going to be greatly affected as the baby's born. It's going to have all of these other issues that we're going to go into. Okay. Now, I want you to also know that the aftermath. So I've given you some of the statistics, far as in the U.S., how we are affected as women, making these choices, about our children. So we have to take full responsibility. There's a lot of individuals that struggle with responsibility. So they think, oh, if I have, a couple of beers, it ain't gonna hurt nobody. It ain't gonna hurt the baby. I've known women to have drunk with their children. And I was the first one to tell them, I don't think you need to be drinking. I know them who have smoked marijuana with their children, saying marijuana is not gonna hurt. I said, no, you don't need to be doing any drugs. Even psycho medication is not given by doctors, when a woman is carrying a baby, because they know that even psycho meds will affect the baby. So, it was, again, it's just being responsible. Now, even with smoking, because I want to, I'm talking about alcohol, but I want to just kind of go down the line, because there could be someone listening that is smoking and say, oh no, smoking is not going to hurt the baby. Yes, it will. It can cause asthma, bronchitis. It can also reduce the amount of weight that the baby will have when the baby is born. There's certain kind of gestational weights that needs to be happening. Babies need to be born with certain type of weights, and this not, you're looking at from the inside structure. Inside structure is the weight of the also the internal organs. It's not just the body or the outside bone structure, it's the inside structure. So in lung capacity, women that drink, women that do drugs when pregnant and smoke, affect the lung capacity of their children. That's not fair. That's not fair to the child at all. You have all of these related issues. You have the National Center of Chronic Disease Prevention and Health Promotion. Talk about all of these other areas that can happen over a period of time. Do you not know your child may not be born with heart disease or have any diabetes or physical active, inactive traits, but as they get older, because of them suffering from birth, the body then is not developing properly. So what happens when the body does not develop properly? Other things happen as you get older. So it is something, that needs to be taken in consideration. Because again, I think when we don't see something, we think it's okay, but that's not true. You don't see the damage, but the damage is always there. Always there. So I want to also give you some information, excuse me, from the CDC. Since 2020 up to 21, again, we have increased tremendously. We have gotten in domestic violence, if a woman is carrying a child and if she has a drinking problem, she will increase drinking. If she has a drug addiction problem, she will also increase in that area. So, with FASD, fetal alcohol syndrome disorder, I want to break down what happens in the cause and prevention so that you may have a good understanding. It occurs when a person is exposed to alcohol before birth. Okay, alcohol in the mother's bloodstream to the baby through the umbilical cord. There is no known safe amount of alcohol during pregnancy or when trying to get pregnant. I want to make sure you understand that. You could be drinking before you get pregnant. That alcohol is still in your system. So let's say you conceive through conception. Guess what happens? That same blood is going to run into the baby even before you get pregnant. So people who have addictions to alcohol who get pregnant have a larger chance of having disorders or developmental issues in their children. There's no safe amount, which means it's not just 1% that won't hurt your child. No, there's no safe amount because alcohol is, again, is a substance. It is something that is not digested, is something that's not feasibly enmeshed in the human body. And it is the number one cause, believe it or not crack cocaine, not meth, not none of those areas, none of those other ones. It is the number one legal drug that deteriorates a human being. Legal drug, substance. Anyone can go buy it. Even the children, they'll get someone else, 17, 18-year-olds go buy alcohol. So it's legal. And see, that's what makes it dangerous. Okay, there is no safe amount to drink during pregnancy. Alcohol can cause problems from developing baby throughout pregnancy, including before a woman knows she's pregnant. All types of alcohol and are equally harmful, including wines and beers. I knew women that drank 2 glasses of wine and they said, "Oh, there's something gonna happen. I could do that." That's not true. It is very, very dangerous to do that because, again, a baby's system is so delicate, it cannot digest substances. To prevent FASD, fetal alcohol syndrome, a woman should avoid alcohol if she is pregnant or might be pregnant. This is because a woman could get pregnant and not know for up to 4 to 6 weeks. So if she's binge drinking, y'all, if she's having a good time, if she's drinking alcohol, if she's drinking beer, whatever, 4 to 6 weeks, all of that is in her system and it is being digested by that baby. That's right. It is never too late to stop alcohol use during pregnancy because the brain growth takes place throughout pregnancy from the time of conception all the way to 38 weeks. The brain is growing. So, because the brain growth takes place throughout pregnancy, stopping alcohol use will improve the baby's health and well being. So, that's the goal, is to stop putting the substance in the body so that it doesn't affect the baby. Now, this is how it affects the baby. So, these collections were actually diagnoses that from statistics and also testings, and this is what they came up with. It affects people differently on different ranges and from mild and severe. I just want you to know that as well. You have low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially in math, learning disabilities, speech and language delays, intellectual disability or low IQ, poor reasoning and judgment skills, sleep and sucking problems as a baby. Oh my God. Vision or hearing problems, problems with the heart, kidneys, or bones, shorter than average weight, small head size, abnormal facial features, such as smooth ridge between the nose and upper lip. This ridge is called philtrum. And oh my goodness, that list is long enough. That list is long enough. And this is what I want to go back and say. I want to pull out some of these areas here. I want to pull out difficulty with attention. What does that sound like to you? Attention deficit? Yes. ADD. So I guarantee you, if we did a statistic and we went and looked at all the children and their parents that had ADD, we may find that someone was drinking while pregnant. We may find that. This other one as well, learning disabilities, intellectual and disabilities in a low IQ, reasoning and judgment. All of those are based on the cognitive ability of that child. So as these things continue to go on, they create other things because think about it. It's not one of those fix-alls. You can't give a pill and say, "Oh, that's going to help you learn more, or that's going to improve you sucking and feeding on a bottle." No, this is permanent. As they get older, it's going to affect their life. The fetal alcohol syndrome is one of those ones that where the mild to severe. Okay. So let's break this down because I want you to know it's just not fetal alcohol syndrome. There's other things that are happening in this baby, in this child, as they grow up. So you have the attention span is shorter, the vision and hearing mixed upon these problems. They have a hard time in school and trouble getting along with other people. So their emotions are also affected. Their mental capacity with interpersonal skills, which is one on one, intrapersonal skills within a group of people. They have shorter attention spans, but most of all, they have a low will tolerance, very impatient, very short patient, no tolerance, short tempered people. Okay, so as they grow up, this is what's going to happen if they don't get help, of course, in some type of therapeutic process. The next one is called alcohol related neurodevelopmental disorder. And again, this is still dealing with alcohol syndrome. People with alcohol related neurodevelopment disorders might have intellectual disabilities and problems with behavior and learning. They might do poorly in school and have difficulties with math, memory, attention, judgment, and look at this, poor impulse control. Poor impulse control, which means they're reactive. They're just reactive. They don't think about anything before they do it. They just do it. They also have another area here. It's called the alcohol related birth. Alcohol related birth. That's people with this have problems with their hearts, their kidneys, and their bones, hearing and hearing loss. They may have a mix of these. They have areas with life skills. They have problems with life skills. And they're not able to think very clearly when it comes to life problems. Now think about this. This is something that is going to be ongoing throughout life, is it not? It's going to be something that a child is going to be experiencing for long periods of time. And I when I read this, I was so shocked because I remember even some of my patients having their mothers having alcohol problems. And these people are grown now. They're grown. They're like 30, 40-year olds. And said my mother was an alcoholic and she drank with me. And I said, oh my goodness, this is a good reason why mental health could possibly be the way it is. Because of the parental figures, influencers. And I'm not saying that's all has to do with mental illness, but statistically, I guarantee you, if we did some research, we will find that it's coming down the pipeline. It's coming down the pipeline. So, again, if there's anyone that's listening, please don't drink and do drugs with your children. Um, there is another one here as well, neurobehavioral disorder associated with prenatal alcohol exposure. That's what this is called. And a child or youth with this problem has three areas: thinking and memory, where the child may have trouble planning or may forget material he or she has already learned; behavior problems such as a severe tantrums, mood issues, for example, irritability and difficulty shifting attention from one task to another, and trouble with day-to-day living. Look at that. Which may be include problems with bathing, dressing, for weather, and playing with each children. You know, so they're totally affected. Wow, that's something to think about, you guys. That's something to really think about. Okay, I see my backstage host is in the house. Let me introduce her.
Yes. Grand Rising. Thank you so much for an excellent show. I know that we've got some listeners and viewers that are hearing the story of their lives as you talk about this. Unfortunately, we had many people who drank alcohol while pregnant. Many of them in different states of depression and so forth, and that's how they handle.
Yes.
So, just want to remind our listeners, if you've got a question, please press 1 and we can open your mic and get your thoughts. And we're going to take a quick break and come back, and hopefully, if we have some questions, you can press 1 and we can certainly answer your concerns. I know a lot of people might be wanting to know what can they do if they are a child of someone who drank and they in fact did suffer from fetal alcohol syndrome.
Right. And
We'll
I
be back.
have some preventive tips. So,
It's great. But we'll be right back after this quick break. So just stay with us. We have an opportunity to transform the whole global society in the next 50 years. 50 years from now, the earth will be populated by a new generation of adults, many of whom are yet unborn. Our mission is to nurture them in childhood with love, guidance, and protection, and to raise them in healthy, happy families. If we impart values of compassion, generosity, and respect for fellow human beings in the next generation of children, they will create a world where people can live together in peace. This is our goal. Be a part of the transformation. Get your copy of the book, The Female Solution. go to www.naimalatif.com. That's www.naimalatif.com.
Jesus. Hold on. I feel it peaking for some reason.
Are you constantly arguing with yourself? Are your children misbehaving and acting out? Someone in your family abusing drugs? Have you been a victim of domestic violence? Are you grieving over the loss of a loved one? Let us help you restore serenity to your life. At Serenity Family Social Services, we understand that good mental health is the result of emotional well-being. Our goal is to assist you and your family in removing emotional distress and restoring harmony and balance to your lives. We offer individual, couples, and family counseling. I'm Howard Williams, CEO of Serenity Family Social Services. Call us today at 312-315-4820. That's 312-315-4820. Do you want to live in a world without war? Join our global peace movement. Heavenly Culture World Peace Restoration of Life transcends culture, religion, ideology, and other boundaries to achieve peaceful harmony in the global society. HWPL is committed to bringing world peace and cessation of war through peaceful dialogue between religious groups. I am Director Shin-Suk Kim of the HWPL Chicago branch of North America. Join us for our next gathering. Call 773-580-1501 and be a part of the movement for world peace. Email at chicagohwpl@gmail.com.
All right, welcome back. Welcome back to Soulful Solutions. My name is Dr. Debbie Green with my wonderful co-host Naima Latif, our executive producer of the Female Solution. And if you're just joining us, our topic today is fetal alcohol syndrome and the after effects on our children and adults. And adults. So if I want to say, if you were a person that has been affected by your mother's, consumption of alcohol while she was carrying you, and if you started knowing traits, because these are lifetime results. These are not. It's not something just right there in the moment of the child. It is something that lingers. It's because it's related to so many different disorders. It's related to ADD, ADHD, as well as some mental disorders and personality disorders as well. So I just want to make sure that you know that. I went over statistics earlier. So I think what we left off, I wanted to give some more information on just the mental capacities of this person. I think I lost you.
Yeah,
There you
I'm
go.
step away for a moment, but before I
Oh,
go,
okay. You did it on purpose. Okay. I'm sorry.
but I do want to urge our viewers, type in your comments if you have some questions, and our listeners, you need to
Okay.
press if you've got a question. But I'll possibly be able to be back after the next break.
No problem.
We
No
want
problem.
those who are listening and viewing, if you've got questions, to please ask, and Dr. Debbie will be able to answer your questions.
Absolutely. Absolutely. Okay, so what I want to do is go into some preventive tips when it comes to, of course, if you felt that you have suffered in some type of way with any mental or personality I don't like to use the word disorders. Let's let me use challenges, okay? Mental or emotional challenges. Now, sometimes what happens is when we are exposed, to alcohol internally like this, with or without our permission, it causes different things to happen. Of course, I went over memory loss. I also went over the thinking, cognitive abilities to sort out different issues. You become more emotional than most. Um, Rejection sensitive. Okay, and if you don't know what that is when you feel that you're not being taken seriously. So you experience certain things like when someone's, not talking to you or don't actually pay attention to you the way you want to. You may feel betrayed. You may feel taken advantage of, different things of that nature. And I'm not saying that it also comes from alcohol fetal, syndrome, but what I'm saying is that it's a good chance if you had that exposure. That's the reason why that you feel the way you do is because you're a little more empathetic than most. You feel through life. So if you find yourself feeling through life, then you really need to then take some time and start shifting over to that logical mind, because this cannot be repaired until you repair it. I can't express to you how important it is for us to do self-care, especially if we was affected by this particular behavior of our parents or our mother, because our mother is the one that actually carried us. So if we were affected by this and you see and know that there's some long-term results, you need to do damage control. Okay? Don't just assume that you're going to be all right. Damage control. What is damage control considering this type of issue? Well, think about it. If you have a cognitive issue is your thinking pattern. It's hard for a person to solve issues when they always think that they're in issues. I know that sounds a little odd, but it's true because you're focusing more on the problem than the solution. So I want you to take the time to get and remove yourself from that emotional part of yourself. If you're suffering from any over feeling of things, like, let me give you an example because I want you to really get this. If you find yourself being a people pleaser, if you find yourself living life based upon other people's validations, other people's appraisal of you, if you find yourself being portrayed very easily, or if you're still dealing with the trauma of your life when it comes to you having a parent that drank. And, if it was your mother, you see what I'm saying? And she may have not treated you appropriately, and you still have those thoughts in your mind. Maybe she mistreated you, maybe she said things to you that was horrific, or downgrading or something of that nature. Okay, yes, it did happen, but it's time for you to move. You don't want to stay in that mindset. And the reason why I'm really going here with the adult person, because the damage was done, but it doesn't have to stay that way. It doesn't have, it's just that what happens is now you have to then take time to look and do some damage control, like I said earlier. ADHD, ADD, if you have any of those diagnoses, it's a good chance that, it came from some type of drug use from mom, or, drug, alcohol use. Again, like I said, if she conceived, she could have been drinking, binge drinking, using drugs 4 to 6 weeks before she even knew she was pregnant. Does that affect you? Yes, it will. It affects any child at any time. So the goal is to look at yourself again, examine yourself, and if you know you've been a product of this particular lifestyle or this particular genealogy, you know what I'm saying? Which means that if someone else drank and she's drinking because someone else she was exposed to it as well, then of course you want to break that cycle. You don't want to continue that cycle because it's not going to be healthy for you. Or if you have children, it's not going to be healthy for your children as well. Because again, mental illness and alcohol abuse, drug abuse are very close in perimeter. They're very close in perimeter. Uh, when a person is experiencing this, they don't often take the responsibility to say, okay, I'm going to stop. I'm not going to do this anymore. So, again, I want to give you some preventive tips so that you will at least have some information on what to do and how to do this. Um, over a lifetime of changes, when you are experiencing this, and if you find yourself again feeling mentally distressed very easily, um, if you find yourself having a low will tolerance to life, like for example, if you start shutting down very easily, it's called hypoarousal. You start shutting down very easily, where you don't want to communicate with anyone. You become emotionally numb. These areas like this. This is where you then really struggle because you're shutting down from the inside. So it's very difficult for someone to help you because you're not opening up for help. Okay, or you may go into what is called hyper arousal when you're dealing with life issues. You may be anxious, you may be angry, frustrated, irritated, and it may be something ongoing. So you find yourself, being stuck here, going in and out of irritation, in and out of frustration, and you don't seem like you can find a place of peace. You have to get back to your will tolerance. Your will tolerance is extremely important. What is a will tolerance? That means that I have to tolerate myself and tolerate my life. I have to find my place to contentment. And again, if you are a product of your parent that drank with you, these are just some of the areas of sensitivity that a person will think and feel. And trust me, it starts as early as young adulthood, like 14, 15 years old. A lot of the patients I see at the hospital, adolescents that have low will tolerance, they're they're either hypersensitive to everything. They have a low thinking ability, and a lot of them are very intelligent. It's just that they don't know how to deal with life. They get upset when they're if someone says no or someone doesn't want to be in their life. If their friends don't want to talk to them, they take it so personally till they're ready to end their life. So it's mental illness, and again, substance abuse is real. So we want to definitely be mindful of those things. So let's talk about some preventive tips. Preventive tips is doing one, self monitoring. Self monitoring. What does that mean? That means when you wake up in the morning, you should be asking yourself, what am I thinking? What am I feeling in my heart? What is my body telling me? Self monitor every morning and choose a word for today. A word for today is something that is going to keep you focused. It's going to keep you in a place where you will have what they call a navigation. You will be able to navigate through life very successfully if you choose what you want. Use your power of choice. Power of choice is the most important thing that God gave us, but most of all, you should give yourself. And again, we can't prevent what has already happened, people. If you're still reliving any trauma from your past, such as a mother or father that drank, and you find yourself just keep thinking about it over and over again, taking away from your own life. Time and frequency is everything. You have to ask yourself, how much of this should I give myself to? So what am I saying to you? That's what self-monitoring comes from. It's monitoring your thoughts, monitoring your feelings, and they have to be justifiable. You can't, when you're thinking only in the past, you can't control the past. The past has already happened. You can only control the here and now. That's all you can control. Only control the here and now. So just be mindful of that. Be mindful of everything that you give to yourself and take care of yourself. Another preventive tip is also getting therapy. Going and get therapy when you know that you're having these issues. I know a lot of people don't want to get therapy. They don't want to talk about themselves. They don't want to have the stigma of that. But I think this is necessary. This is going to help you to get things out and into the opening. And if he or she is a good therapist, they will help you journal. They're going to help you cope. They're going to give you strategic skills so that you will be able to get on with life, move on, and not find yourself stuck in so many uncomfortable positions. So just be mindful of that. Another strategic tip I also want to give you is your health, eating right, exercising. That has a lot to do with what you're doing. It's a lot to do with how you're living. You know, I think we forget how to be sometimes. We're so busy, focusing on the doing that we forget how to be. And the being is requires you to have a certain type of life. And it's not perfect life. It's just a life of health, a life of endurance, a life of positivity, a life that well lived, a life well lived. So I want you to take that into consideration. And if you know someone, again, that is, drinking while pregnant, doing drugs while pregnant, you need to let someone know. Let them know, but you may need to let someone else know as well, especially if it's severe, because it's so dangerous, again, to the baby. So as you are doing this, as you grow up, again, I'm going back to adulthood. I'm not going back and forth, but that's okay. Just walk with me. You're dealing with memory, attention deficit, judgment, poor impulse skills. Again, self-monitoring will help you with this. Living your life from a proactive instead of a reactive. Proactive is just what it is. I am going to think about what I'm doing before doing it, before even saying it. I'm going to think about before I say it and weigh the options. What good will it do if I say it or do it? Slow down. People with high impulse control are moving very quickly in life, just like driving in the fast lane. They're moving very, very quickly. They're not again, taking the time to think about what is going to happen, how long it's going to happen. They're just doing it. So they put that energy out there in the atmosphere. And that energy then, of course, turns into other energies. Because energy expands, it does not disintegrate. So just be mindful of that. And you ask yourself, how well are you living your life? How well are you living your life? And how are you helping yourself in the process? I think that is extremely important to know how you living your life and how well you're living it. Um, if you've already had a child, if anyone listening has already had a child and also was drinking, how do you deal with the child? The child will have a low will tolerance. She or he will have more tantrums, very colic, like colic babies. If you ever have a baby that has colic, when a baby has colic, it is dealing with some type of substance. You know, far as again drugs and alcohol. The baby may cry excessively, um, may not eat right, may not suck the bottle or nipple when feeding. They may go through all types of, mood changes, early on. I mean, early, like before 10 years old, they may change in moods. But as they get older, they will continually to change in moods, and it's almost noticed as though it could be a mood disorder, and the brain is affected by it, and there is a good chance that they may even get a diagnosis with that as they get older, because they can only be diagnosed up until they're 18 years old with any type of mental illness, as far as bipolar, schizophrenia, any of those. But depression, no, you could be depressed at age 5. You can have a depression, low energy, you know low self-control. All of those again are just the after effects of the fetal alcohol syndrome, or drug addicted mother. I think that's very important for us to realize. So it looks like we're going to have to take a quick break because it is the 9 o'clock hour, and I will be right back. Okay, welcome back. Welcome back. This is Soulful Solutions. My name is Dr. Debbie Green. And again, our topic today is alcohol fetal syndrome and how it affects our children mainly and also our lives overall. What I want to do also to break down some of the mental side of this development in the children as well as the adults as they get older. As early as 12 to 13 years old, the mental effects on this child when it comes to alcohol, um, exposure is very, very major. We have a part of our brain that helps us with our developmental and thinking capacities from temple to temple, as well as the parts of the brain that organize memory, organize thinking, and mathematical skills as well are greatly affected. So mental illness can actually set in our children from alcohol fetal syndrome exposure as early as 12 to 13 years old. And the thing about this, if again, if the parents are, honest enough to let the doctors know I drank when I was carrying her or him, then they would know how more so to treat it instead of them not telling them. Because a lot of times they don't say it until it's revealed in the blood. So they have these toxicology reports. So to kind of break it down just a little bit, I want to really talk about two areas mainly that are affected by the alcohol in our children's as again as early as age 13. Okay. Alcohol can affect your child's brain, which continues to develop until the early 20s. I want you to pay attention to that. Early 20s. So it starts in the womb, comes out, and then starts a whole nother pattern of developmentals breakdown. And then once they get a certain age, like I said, about, you know, 12 years old, it keeps causing issues all the way up to the 20s. It just doesn't stop, you know. Alcohol can negatively impact on our child's problem solving skills and performance at school, as well as potential affecting their body, mood, and mental health. There are several parts of the brain affected by alcohol during the teenage years. However, there are two areas, and I want you to pay attention to these two areas that are mostly affected. It's called the hippocampus. The hippocampus is a part of the brain that is responsible for the memory and learning. Studies of adolescents show that heavy and extended alcohol use is associated with 10% reduction in the size of the hippocampus. Not only does it affect your memory and your thinking, it reduces brain mass. Wow, that's something to think about. It also shows that the functions of the hippocampus is usually sensitive to alcohol at this time, and that alcohol may be poisonous to the nerve cells of this hippocampus, causing them to be damaged or destroyed. That's the reason why it affects us. It affects a person all the way up to their 20s, probably longer than that, because those areas of the brain are destroyed from the substance. The prefrontal lobe, which is important for planning, judgment, decision making, impulse control, and language, is the area of the brain that changes the most during the teenage years. Research with heavy drinking adolescents shows that these young people have smaller prefrontal lobes than younger people of the same age who do not drink. The body of research about the effects of alcohol on the developmental brain is still growing. This is something to think about. So, that being said, the goal is to majorly get some help, especially when you know that you're going through those things. You definitely want to get some type of redirection or help because it's not a pill or an injection that can solve this. It's something that, again, the child or the person is going to go through. The earlier a person starts drinking alcohol at harmful levels, the greater risk of changing the development of the brain. This can lead to problems with memory and learning and increasing the risk of having alcohol related problems later in life. There it is. There it is. Hmm. I think that's extremely important because, again, our life is affected. It's affected by all of these things. And it's a good chance, again, that you've been affected by something you didn't even know anything about. You may have not known your mother drank or not. And if you did know, you couldn't do anything about it. It was just something that you were experiencing. But most of all, it was a harmful something. Because alcohol is a depressant to the brain. So the baby is going to feel depressed. The mother is definitely going to feel depressed. And it'll be an overall, you know, area where it takes away from the functioning. It takes away from the ability to filter through life. I think this is heavy. This is something. And a lot of people are going through it. So the question is, when a person finds that out and then makes a decision on whether they should drink or not, let's see about those statistics. What I'm finding out is, okay, we have 6 out of 10. 6 out of 10 people. If your parents drank, there's a good chance you will also drink as well. Unless you made that decision not to, of course. And let's hope you would make that decision not to drink excessively. I mean, everyone socially drinks, but drinking excessively is an issue. So you don't want to do that. You don't want to build that habit. You don't want to build that habit at all. Okay. That's good. I'm glad that I found that information for us so that we will know how to do damage control. The long terms. Let's talk about long term effects. Remember, I told you that it would, you would carry this all the way into your 20s. And there's a good chance you will continue to carry it all the way through the rest of your life if you don't know about it and don't do anything about it, of course. Some research suggests that even over the shorter time frame of adolescents drinking alcohol can harm the liver, the bones, the endocrine system, and the brain, interfering with growth. So during puberty, accelerating cascade growth factors and sex hormones set off sexual maturation, growth in stature and muscle mass, and bone development. Now, this occurs again at the teenage years, and it goes into the 20s, and it goes also into the 30s. I want to make that point. So, as this is done, the research has also found differences in effects of binge-like drinking in adolescents compared to adults. Because it happens when they see their families, members, their mothers, fathers, sisters, brothers drink, they also drink. So it's an influence thing. And again, it also affects the human being overall. The medical consequences of chronic alcohol abuse and dependence have been well documented in adults. They include liver disease, lung disease, and compromised immune systems, endocrine disorders, and brain changes. Investigations of the health problems associated with adolescents' alcohol abuse are sparsely and rely mainly on self report, which again, they don't ask you. When you go to the hospital, very seldom does a doctor ask you, are you a heavy drinker? They will if you have heart disease, but most of the time they don't ask you that question. They don't ask you that question when you are having a prenatal check. They don't ask that question. So again, it is your responsibility. It's your responsibility to take care of yourself and your unborn baby. So let's look at some of the gender like between males and females. In both males and females, puberty is a period of activation of the hypothalamic pituitary gonadal gland, where all the hormones are being released. Now, in males and females that have alcohol syndrome, these hormones are delayed. And when they are delayed, then developmental cannot go forth. The increase in these hormones not only promote maturation of the gonads, but also affects growth, muscle mass, and the mineralization in skeleton tissue. So if they have, again, if they've been a product of alcohol syndrome, fetal syndrome, they will lack the normal developmental issues or, outcomes, I would say. So they will struggle in those areas right there. Their bodies will not look as normal as a normal child would. Their brains will not think, and their internal structures will definitely be challenged internally. They may not operate to their full capacities. And when they don't operate to their full capacities, other things happen later in life, as I told you. So again, the female is not just affected. Well, it affects male and hormones in our adolescence. So it's not just the female hormones that's affected. I also want to talk about long-term behavior and physiological consequences of early drinking in adolescence as well. Although increased tolerance to alcohol sedative effects may enable greater intake in adolescence, repeating exposure to alcohol may produce increased sensitivity to alcohol hormone effects. Studies have been known to say the developmental sensitivity of alcohol was observed in the hippocampus. But more recently, this effect was found outside of the hippocampus as well, in the cells of the brain. So we can say that it affects only not just the hippocampus, but also the outside perimeters, which then, of course, it affects us, that person, developmentally. They will not be able to do most things at 100% as some other people would. Okay. So if they're binge drinking, okay, if they're binge drinking, they're most likely to engage or have, areas of brain structure, neurochemistry, and cognitive dysfunction. Care must be taken in intra explodiating, which is that they must take care of themselves and really do a lot of detoxing. The detoxing rate has to be on a daily rate because the thing about this is babies also go through withdrawals, okay, as well as young adults or teenagers, they go through withdrawals as well. So if you've ever seen or never seen a person go through withdrawal from alcohol, it is a very uncomfortable thing because they have DTs, deleterious. They also give behavior like they are very lethargic. They are sweating profusely, have pain in the stomach. Some have extreme nausea, diarrhea, like flu-like symptoms. That's what they have, flu-like symptoms. And a baby can have flu-like symptoms being born, just being born. I couldn't imagine it, but it's true. Flu-like symptoms. And all they did was come into the world. Isn't that something? It is such a challenge topic for me, um, because I just don't think it was fair for that child to go through what it went through. So the long-term effects will happen up until from birth all the way through childhood, adolescence, and all the way till 25 years old. That's how long it's going to take. Okay. All right. So I want to give some more tips here, if I can. How alcohol, again, let's look at how it affects the mind. Let's start with number one: decision making, impulse control, and personality. Alcohol slows down the brain and makes it harder to make good decisions, concentrate, and control impulses. So if you find yourself short tempered, it's a good chance you may want to look back in your lineage and see if your mother might have drank alcohol and you didn't know anything about it. Number two is memory, learning, emotional regulation. Young people are more likely to have memory blackouts when exposed to alcohol, where they can't remember what happened while they were drinking or while their mother was drinking. Number three is movement, balance, and coordination. This is why accidents and injury are common when young people drink alcohol. So the mental harm is this: alcohol use, especially at a young age, increases the risk of experience mental health issues, including depression, there it is, and anxiety. For young people who experience mental health issues, drinking alcohol can make symptoms worse. Alcohol can also interact with over the counter and prescription medication, including antidepressants. Young people who start drinking alcohol at an early age are more likely to have problems with alcohol later in life, such as binge drinking and becoming dependent on alcohol. The later teen delay their first alcoholic drink, the less likely they will drink alcohol regularly, and less likely they will experience issues with alcohol as an adult. Okay, that's a point. That's a point. So if this child again was exposed to alcohol before birth and they grew up in a household with their mother drinking, or father drinking, or someone drinking, there's a good chance that that child will pick up that same habit. So if that child picks up the habit, then it's going to be exposed. And that's when things start to change. So they then also, if they continue to drink the way they are, if they have children, it just gets passed down. Young people who start drinking alcohol at an early age are more likely to have problems with alcohol later in life, such as binge drinking and becoming alcohol dependent on alcohol. Alcohol dependent on alcohol. The later teens delay their first alcoholic drink, the less they will drink. Okay? Even in adulthood, regular drinking alcohol, even at low levels, causes damage to the body and can lead to serious disease, including cancer or even stroke. It does. I don't understand why they don't stop drinking when they know that it's hurting the baby. Okay. Risk of illness, accidents, and injury. Young people are still developing skills and make good decisions, and their brains do not assess risk in the same way that adults do. So, adding alcohol to the mix can further increase behaviors that can end in harm like behavior. Vomiting, alcohol poisoning, and blackouts. Injury, including assaults, falls, and road accidents. Unwanted or unsafe sex, treating others in a way they normally wouldn't, or arguing or having a fight and harming important relationships, behaving in a way they otherwise wouldn't, potentially damaging their reputation. So, do you see the differences in this? Do you see how it changes a person's life? They're no longer that, you know, they're just they're just disrupted completely. They're disrupted completely. So alcohol in your health is not healthy at all. Again, social drinking is fine, but when carrying a child, you don't want to drink alcohol when carrying a child. So let's look at also, I want to not, I know we started off talking about the US, but I want to look at how other countries also look at this as well. Let's take, for example, Australia. Around 70% of alcohol users drink in Australia. 23% do not drink alcohol. In 2019, the proportion of ex drinkers increased significantly from 2016 being 7.6%. It started increasing 8.9 starting in 2019. Now we know because of the pandemic had a lot to do with that. 1 in 3 adults who drink alcohol drink at levels that exceed the alcohol guidelines and put them at risk of alcohol related injury and disease. Wow, that's something, right? So if they were drinking and pregnant, it's the same thing right there. That is the statistics. because drinking and pregnant is not good. But also drinking and driving is worse. Okay. All right, it looks like it's 9:30. I'm going to take a 2-minute break and I'll be right back. Okay. Welcome back to Soulful Solutions. My name is Dr. Debbie Green, and thank you for joining me today. And again, today is just an information day based on alcohol fetal syndrome. Alcohol fetal syndrome. Not sure if I have any callers on the line, but if I do, I hope that. Okay, we do have a caller. Um, okay, hold on one second. Let me see if I can pull that up for you. One second. Um, see if I can pull that up. One second. I have to call in. Let's see here. To
Welcome to Blog Talk Radio. Please enter your host PIN. When finished, press the pound key. To start your show now, press 1. To hear important instructions, press 2. It appears that the host has already dialed into this show. Only one host is allowed per show. Thank you for using Blog Talk.
okay, will you call in, guess? I can't. Okay, let me dial into the show. Let me dial into the show. This is okay.
Blog Talk Radio. We're sorry, but the toll-free number for this show is...
Oh God, this is really okay. All right. I'm trying to actually get a Blog Talk caller online, so I'm struggling right there. Just bear with me for a second. Thank you. Okay. Let's call in this number here. Thank you, everyone on Facebook, for being patient and waiting, and also on YouTube.
Blog Talk Radio. Welcome to Blog Talk Radio. Please hold and you will be able to listen to the show. And connecting with Dr.
Okay, is the caller on?
like you have experienced that, then we certainly want you to give your story and how it affected you.
Okay. I don't hear anyone. Should I hang up? Okay. It's just making a lot of noise, so you know. Okay. I don't know if that caller is going to be able to come in or not. It's a little bit too much going on.
Okay.
Okay. I'm going to hang up because I
You can
don't
hang
think
up
that's
the
going to
other.
work.
Yeah, you can hang up the other line.
Yeah.
All right.
That's
So
not
let's
going
see
to
if we
work.
can bring our caller in.
Okay.
And
That looks like a fun trip you're taking there.
oh yeah, fun. All right. So let's see now. I know there are quite a few people who are listening online, and I want to make sure they get an opportunity to speak. Okay. All right. So let's bring in our caller. Area code 312-833. Go ahead. You're live on the Female Solution Radio Show. Go ahead with your comment regarding fetal alcohol syndrome. Only regarding fetal alcohol syndrome. We're doing a lot to bring you on this morning, so make sure you're on topic.
Oh, here you go.
Peace and love and assalamu alaikum to you, beloved sister. Name of the team is the Female Solution, Brother Paul.
Yes.
Chicago, Illinois.
Yes.
Yes, my question is, I'm not sure. I knew my mother was a drinker, that she drank alcohol. I'm not sure on the fact that if she was drinking during the time that I was born. However, I wanted to know if a sister is being, included in alcohol and develop alcohol syndrome, would she recommend a PMA class for a sister like that in that kind of condition or situation, and order that she might, because the mother of any child would be the leader of that child. So, I wanted to lead by example. So would she recommend a special class, like PMA class for her to take in order, and then also that she might receive atonement? She must atone within herself in order to refrain from the alcohol drinking that she does, in order that she and her daughter might be prosperous in the community.
All right. Well, thank you so much, Minister Plum. We appreciate that. All right. Well, I'll
Okay, how
get
old
off
is
and
she?
let you answer that question.
Right. I wanted to know how old was the sister, But anyway, if if needed, yes, she can go into programs, which is substance abuse programs, and those substance abuse programs are mainly in every community, every state, and they do come with psychological therapy in them as well as detox, the process of detoxing. But again, that person has to make a conscious decision to do so. They have to make a conscious decision to come out of it, to do something different. Otherwise, they, again, continue that same pattern of life, continue that same lifestyle, and it's not going to get any better, because it's just going to break the body down physically, mentally, emotionally. So again, definitely go into a residential program. That will be the first. Usually they are anywhere between up to 15 days being leased and up to 3 months. It just depends on what type that you have there in Chicago or wherever she may be residing. Here in Atlanta, in the Georgia area, we have them 20 days, 30 days, 60 days, in length. And again, it comes with detoxing as well as therapy. So that's a good question, Minister Plump, because someone needs to make a decision soon to come out of the same things that they've been doing. And if there's anyone in the sound of my voice that are dealing with any alcohol issues, now if you in denial, you say, no, it's not me, even though you drank 5 or 6 beers a day, and you're like, I don't have no alcohol problem. That when I get home, I just want to take a drink, you know, after working all day. And I mean, I understand. But the thing about this is you got to look at your consumption over a period of time. It's over a period of time. It's not right there in the moment because most people binge drink. People drink 24 beers over a whole day and like just over a weekend. Okay, 24 beers. That's a lot of alcohol going in the body at one time. Some people drink fifths, liters of alcohol. They drink, 2 or 3 bottles of wine. And alcohol turns into sugar. That's what it does. It turns into sugar, and that sugar slows down the bloodstream. And when then before you realize, inflammation starts to develop in the internal organs. That's when it breaks down the liver because the liver can't flush it. The liver can only flush but so many toxins over a period of time. And as those toxins are constantly building up, then that's when cirrhosis comes. And then the liver starts to bleed from the internal areas. You won't know. Liver, they don't give, it's not like, you have a cold and it gives off a symptom. No, a liver doesn't give a symptom until it is full to capacity. That's what it does. It has to change the way your biochemistry is, where those toxins are not being broken down inside through the lymphatic systems that usually the toxins come out of. So if those things are not happening, you don't know. And you're steady drinking, thinking that everything is okay, and it's not. So just be mindful of that. And again, if you know someone that does drink, and if they're willing to get help, because some of them can get very stubborn. I'm not drinking, I'm not an alcoholic, but everybody else can see that you're drinking and you're alcoholic. But you are the one that does not want to admit this. You cannot do anything from a person who's not ready. You know the old saying, you can lead the horse to water, but you can't make him drink. Okay, that's the deal. That's the deal. And it is a um, it is a sad thing to watch a person drink and they don't stop it. I think one of our comments from our Monday's host, so very true, Dr. Debbie. My sister drank herself to death because we saw how it ravaged her body and she developed diabetes. There you go. Yeah, yeah. Yeah. Heart disease, diabetes, even forms of cancer, high blood pressure, major life-changing things. And we often wonder, like, you see a person drink and they know their bodies are being torn down, but they don't stop. They just keep drinking because they don't have the ability of the will tolerance. It's the will tolerance every single time. The will tolerance is like, I don't love myself enough to stop what I'm doing. And I've given up. And when a person gives up, they're going to keep doing what they're doing. They're going to keep doing drugs. They're going to keep drinking with or without being pregnant. They're just going to keep doing it. And the after effects are horrendous. They're just not good. So again, just be mindful out there of your alcohol intake. And what, let me say this, and this is probably a little different topic, but I want to put this out here. Do you know if you are abusing alcohol? Are you aware? Okay, what is abusing alcohol? You look at your weekly consumption. Your weekly consumption will let you know, and your frequency. Frequency, for example, I drink 2 glasses of wine a day. So 2 glasses of wine a day, okay, think it's 7 days in a week. I'm sure you're going to exceed that 22-ounce bottle. That 22-ounce bottle may not last because I think wine comes in a 20. I don't think it doesn't come in at 18, so it's either 22 or 32, or gallon, liter. So when you're getting into those areas, then you are consuming large amounts of alcohol in your system, and now again the liver is working overtime. And it is one of those things that it is so um, you won't know the damage until it's done. Also, Monday Soul sent some good information. Let me put that on the screen for those who can see it. Free download on how I reverse type 2 diabetes at diabeticdonut.com. And diabetic donut, it's a DONUTABC. Okay, I see that. Okay. So anyone wants to know more about reversing that, they may want to go ahead and free download How I Reverse Type 2 Diabetes at diabeticdonut.com. Okay? Just want to make sure we put some information out there for you because we never know who's watching. Never know who's watching. So to tally up on the show, it was an informational show. And you know me, I usually put my 102 cents in everything. But I wanted to talk about statistics today. It is extremely important that we know the after effects of alcohol, even on an unborn child, even on our life, as even on that child's life as it grows up. Again, there's many people that walks this earth that have been subject to mothers that drank and was carrying them when they drank. And you may not think anything of it. It may not be something that you think about. But if you really stop and think, at that changed my life. It changed who I was. It changed even what I feel about my life. So, just be mindful of those things. And if you find yourself or know someone, again, that is battling any type of alcohol abuse, help them by saying, hey, when is when? When is when? When are you going to do something about it? I've been watching you for a long time, and I love you enough to let you know I see you. I see your pain. I see your hurt. And I know that you're trying to fill a void that's unfillable. But one thing that I would not be lesser than a person to do is to let you know that I love you enough to help you save your own life. Because one thing about alcohol abuse, if you don't catch it in time, it's irreversible. It will continue, it will continue to break down the inner structures of this human being. And you've probably seen alcoholics for long periods of times. Oh, they've been drinking for years and years and years, but you don't see the damage inside until that person is no longer here and they suffer from this, they suffer from that. Most people who drink have a problem with mental illness and don't tell anyone. They have problems with depression and don't tell anyone. And when they drink alcohol, they get more depressed. What's the giving on that? You're trying to come out of depression, but you're drinking something that keeps you depressed. Well, I say to those people, at some given point, you got to find out your why. You got to find out why you're doing it and why you keep doing it. And you got to face your fears. Because I know you got somebody somewhere that loves you. And they might have given up on you. You might have burnt bridges, talking to females also to drink, carrying babies. You may have given up on life, but don't do that. I'm so sorry that's not an option for you. The option is that you are the giver of life. So if you're carrying that baby in that womb, you are the giver of life. God gave you something so precious, and He just wants you to do the best that you can to help yourself and help that individual. Help them to be the greatness that they can be. So you might have to fight off that addiction. You may have to step back and get yourself clean. But once you get there, you will appreciate life. I've always told my patients and clients, hard work is not work if you don't work on yourself. You can work on any man's job. You can work on anything else in the world. But when you work on yourself, that's hard work. Because you got to face all your fears. You got to face everything that's going on inside of you. It has been there. And then you got to conquer those things. So, sometimes you can't do it alone, people. We could pray about it, but we still need a helping hand. Someone that can listen. Somebody that will always be there. And that's God. He will listen to you, but He wants you to also listen to yourself. So you take care today. Thank you so much, Facebook, for joining me. Thank you, Naima, for moving around and still hanging in there with me. I truly appreciate you. You know what I'm saying? Thank you, you know, uh, oh my goodness, Blog Talk for listening. And I hope that you gained something out of this. And thank you, YouTube, for listening and watching as well. And until next time, Dr. Dev says, take care of yourself. Do something good for someone along the way of life so you can be blessed in the hereafter. Have a blessed day. Bye-bye.